Hey everyone, my name is Allison Lucchese and I'm an associate marriage and family therapist here at Embracing You Therapy. Today I wanted to talk a little bit about a specific OCD subtype called relationship OCD, otherwise known as ROCD. So a lot of times when people think about OCD, they instantly think about cleanliness and just trying to keep everything organized or trying to sanitize everything a certain amount of times or lots of repetition. But in reality, OCD has over a dozen different subtypes. And so again, the one I wanted to focus on for today is relationship OCD. So relationship OCD is when an individual is consumed with doubts about their relationship. So oftentimes the individual will question their love, attraction, compatibility to their partner, but will also question their partner's love, attraction, and compatibility to themselves. The key thing to note here is that if there are obsessions, they are impairing, they are time-consuming, and they are distressing. So in ROCD, there are two main presentations: relationship-centered obsessions and partner-focused obsessions. Relationship-centered obsessions often feel overwhelming by doubts and worries that are focused on the feelings towards their partner. So a lot of times it'll be focused on, does this relationship feel right? A good common example of an obsessive thought would be, is this the right relationship for me? Do I feel right? Does my partner love me the correct way? Whereas for partner-focused obsessions, it focuses primarily on their partner's physical features, social qualities, and personality attributes. So examples of obsessive thoughts for all three of these would be, my partner isn't social enough. Maybe their eyes are too big, and it's just not right. Or they're not emotionally stable. So again, with OCD, there's the obsession and then there's the compulsion. The obsession is the fear, the compulsion is the action that the individual does to try to reduce the anxiety of the obsession, of the fear. So common compulsions include checking one's own feelings. So specifically, do I feel loved in this moment as I'm with my partner? Or if I'm concerned about attractability, am I looking at other people, or am I still solely attracted to my partner? Another common compulsion would be seeking reassurance. This would look like going to friends, going to family, coming to your therapist, and seeking reassurance in, am I in a good relationship? Am I happy in this relationship? Is this love? Is it just right? And then a third common compulsion would be testing your partners, specifically towards their physical attributes. That's just one example of it. The key thing I want to hit and just really stress is the deep down fears that come with relationship OCD. So if a romantic relationship doesn't always feel right, then it probably is a destructive relationship. That is a very common deep fear for someone who is struggling with ROCD. Another common deep fear would be, if the relationship isn't completely perfect, it's unlikely to be true love. Or if you doubt your love for your partner, it's most likely it's not the right relationship. And because these are very common fears, again, we go back to compulsions of checking one's own feelings, of seeking reassurance, or testing our partners to make sure, like, okay, this might be the right relationship, or it might not be the right relationship. So in order to treat ROCD, what we like to do here at Embracing You Therapy is utilize ERP. ERP is it's basically called exposure and response prevention. And so what we like to do here is we like to keep track of what are your obsessions and what are your compulsions, and we like to give it a SUD scale. So how would your anxiety be if you didn't perform this compulsion? Once we're able to fully track what the OCD cycle is, we work on exposures that are appropriate, that have a purpose. So an example would be, say an individual is seeking reassurance. Maybe we'll reduce the number of times that they seek reassurance. Or maybe we'll have them write a script. Everything will be guided, and again, the goal of ERP is to reduce the compulsive behaviors. So reduce the checking, reduce the reassurance seeking, reduce the testing of partners. And again, with treatment, it's manageable. And again, if you have any questions, please feel free to drop the questions in the comments below. Or again, give us a call for a free consultation, and we'll be happy to answer any questions that you may have.